first focus of this morning's lecture is on observational study designs. I know that you've covered experimental study designs as part of some of the earlier sessions in the week. But so I'll focus on observational study designs and methodological approaches in implementation science, and give an overview of a few quasi-experimental methods, specifically, and not in this order, regression discontinuity, interrupted time series, and difference in differences. So really the point, hopefully at the end of the talk today, you'll get out of it a little bit of orientation towards some common observational quasi-experimental study designs and methodological approaches, and to distinguish between and understand some of the assumptions of common quasi-experimental designs to assess intervention strategy effectiveness. And these are the three ones that we'll cover. And I'm not going to go into discrete choice experiments as part of this lecture, but if there is time, I will be prepared to talk about it. I just wasn't sure how we would be doing time-wise today. So because, well, you may have seen this schematic before. It really shows the translational pipeline of how we go from thinking about what interventions we could develop that could potentially work and doing efficacy studies into effectiveness studies about does a program work, and then into research about how to make a program work even better. And this tends to be this tends to be a big focus area for implementation research. This top right of the slide here, making a program work, understanding through generalizable research methods how to implement and sustain effective programs and integrate them into real world settings. But I do think implementation science and implementation research has a role in some of these earlier stages as well. And a lot of this research earlier on in the pipeline can benefit from thinking about implementation down the road and in advance, and involving folks who do research in this area. So because implementation science tends to happen in the real world settings, it becomes important to achieve and challenging to achieve both relevance. The real world settings provide real opportunities to do relevant work in populations that are exactly those that large scale implementation is trying to reach. But it's also challenging to make sure that the science and the methods are rigorous enough in order to make the work useful. So this is a slide, a schematic that comes from an editorial that Elvin Gang and colleagues produced a few years ago, and it helps to draw distinctions between more narrowly focused, the kinds of work that more narrowly focused RCTs, randomized controlled trials, might be focused on, and those that might be more pragmatic in nature. And so they talk about the 4 Ps. So research that is not very relevant and also not very rigorous is considered puerile. Research that is relevant but not very rigorous is populist. Research that's very narrowly focused, for example, on very specific populations, very controlled settings that aren't necessarily representative or generalizable outside of them, can be very rigorous in terms of answering a specific scientific question, but not necessarily relevant. And those studies can be sometimes pedantic. And then there's this sort of sweet spot, which I think implementation science and implementation research is really trying to achieve, which is relevance to real world diverse practice context, while also having high levels of methodologic rigor. And so that's sort of, I think, a sweet spot for implementation research, since it does seek to understand and work within real world conditions, rather than trying to control for these conditions or remove the effect of the influence of context as causal effects. So some generic implementation science research questions might include things like, is a given intervention feasible and acceptable to implement in the real world? Or is the intervention effective? And what can we learn about how best to implement that intervention in the real world? And then, can you package the intervention into delivery strategies or implementation strategies that make it more effective and impactful when implemented in real world settings? And so depending on the intervention strategy and the setting, and as you probably covered earlier in the course, you can sometimes use experimental approaches. So regular randomized controlled trials, cluster RCTs, stepped wedge designs, and also some of these hybrid trial designs, type 1, 2, and 3. But in real world settings, you often find yourself in situations where experimental approaches might not be feasible for a variety of reasons, logistical reasons or ethical reasons, and maybe even experimental approaches aren't desirable. The only way you might be able to do an experimental design is by, for example, only having individual level informed consent, excluding people with comorbidities, ultimately potentially reducing the generalizability of your study. So in these situations, rigorous observational methods can often be a really good substitute, and sometimes even a better one. And these observational methods can include some traditional observational methods, which I'm sure many of you are familiar with. And then there's also increasingly being used in implementation research, natural experiments and quasi-experimental methods, which is the focus of what we're talking about today. So you've probably often heard that RCTs are considered the gold standards, but these aren't always feasible. Sometimes groups can't be randomized to an exposure, treatment, or intervention. So you can't randomize people to smoke or not. Sometimes the exposure or treatment or intervention that you're interested in studying occurs for an entire population, and so there are no unexposed individuals. So this would be a situation like a national policy or a smoking tax that affects the entire country. And oftentimes, this is a situation I found myself in, many times, is that the intervention that you're interested in understanding how it works or whether it's effective has already been implemented. And by the time your approach to sort of help, conduct a research study about the effectiveness or about its implementation, it's already been implemented. And so there's no way to really control exposure or manipulate exposures the way you do in RCTs. So we can think about natural experiments, and the classic example goes all the way back to one of the earliest epidemiological studies in 1854 with John Snow and cholera, where he recognized that the opportunity that really presented itself, where the water supply going to different homes in the area of Soho in London really was, for all intents and purposes, randomly determined. Two neighboring houses could be served by a completely different water supply company, and so it was essentially a random assignment or a natural experiment, and it allowed him to ask the question of whether or not the water supply could be a determinant of the risk of cholera and cholera deaths. So natural experiments exploit this potential quasi-random variation around the exposure of interest to help you identify causal associations. And this is where the term quasi-experiment comes from. It allows you to compare an exposure or a treatment or an intervention arm with a counterfactual. There is exchangeability, meaning that there is an equivalent distribution of potential outcomes for both intervention and control groups. So we will cover a few commonly used quasi-experimental designs today, just to begin to orient you to these approaches. The first one will be interrupted time series, which is a method or a design that can help you assess whether the temporal trend in the time series for a particular health outcome is interrupted or by an exposure, treatment, or intervention that occurs at a specific point in time. We'll also cover the difference in difference design, which allows you to assess changes in the occurrence of a health outcome before and after an exposure relative to that of a comparison group. And then we'll also talk about regression discontinuity, which assesses whether outcomes are different for two groups on either side of the threshold of a continuously measured variable. And so I also want to highlight here that sometimes you'll see that I'll use these abbreviations for these different methods. So ITS, the DID, and RD.